Okay, so tonight we are with the pre-health admissions panel. This breakout room specifically is with the dentistry, pharmacy, and optometry. So we have representatives from each program. We're going to be talking, they're going to be introducing themselves, their program, their school, talking a little bit about what all of it entails. So if anybody has questions, feel free to ask, either if you're comfortable unmuting yourself, by all means do that and ask, or if you want to type in the chat, I'll be monitoring that and I could ask those questions for you as well. So I think we're just going to start out with having the panelists introduce themselves, and then we can just jump into some couple questions. If you guys want to talk about a little bit about your school and program briefly while you're introducing, that would be excellent as well. But I think we'll start with dentistry. So Jamie, if you want to go first.
Boy, pressure to set the tone, huh? Wonderful. I'm not a talker, so I'll be brief, folks. Well, welcome everyone. My name is Jamie Campbell. I'm the Assistant Director of Admissions at the University of Louisville School of Dentistry. Glad to be with you all tonight. We are located in Louisville, Kentucky, which is not too far north from UT Knoxville. I don't know if I need to really go into what a dentist does. I know that was part of the prompt. I'm hoping if you are interested in dental school that you are familiar with what a dentist does, but it is, it's a profession that plays an integral part of a person's overall health and being a part of a person's healthcare team. And so I'll leave it at that and just have everybody else introduce and wait for questions.
Is it our turn?
I think it is.
I thought you were going to go ahead.
Hey, good evening, everybody. I'm Stan Covington, Dean of Admissions at the University of Tennessee Health Science Center in Memphis, along with Dan Myers, our Director of Admissions. It's like Jamie said, if you don't know what a dentist does, then this may not be the right room for you. But it's a wonderful profession. It's not for everyone. I guess Dana and Jamie and I will try our best to answer your questions. Thank you.
We can go with pharmacy next. So Melissa, if you want to go next.
Sure. I'm Melissa Smith. I'm Coordinator of Student Services for the Knoxville campus of the College of Pharmacy at the Health Science Center. So I'm here, but we have campuses in Memphis, Nashville, and Knoxville. And you may already know some. I'll just throw out a couple of quick blurbs. Again, I'm happy to tell you about pharmacy if you need more information. You may not. Hopefully you know a little bit. For our student body now, we have a new opportunity. All the students we admit to our program have historically spent the first year of the program in Memphis, and then they could finish their 4-year PharmD in Memphis, Nashville, or Knoxville. We now have the option for students who are interested in Nashville or Knoxville to only spend 1 semester in Memphis. So both of those are going to be options depending upon what works better for those students who are interested in leaving the Memphis campus either after 1 semester or after a whole year. So happy to answer questions about whatever you got, career, program, whatever. I'll turn it over to Joy.
Hello, I'm Joy Hurley. I'm the Assistant Director of Enrollment Management at the Bill Gatton College of Pharmacy with East Tennessee State University. And again, like Melissa said, we're here to answer any questions that you have about pharmacy as a career, pharmacy, how to get into pharmacy school, best practices, finding the right fit for you. We have all great students. So we're here to be a support for you and partner together to get you into pharmacy school.
Perfect. Mike, if you want to go next for optometry.
Sure. Hello, everybody. Great to be here. My name is Mike McKeever. I'm the program coordinator for the Hayes Center for Practice Excellence at Southern College of Optometry in Memphis, Tennessee, actually right down the road from the UT campus. The Hayes Center for Practice Excellence is our career services program at the college, so I head that program. But before that, I spent many years in admissions on the admissions committee, and I was one of the recruiters for the college. So I've been doing this for quite a few years. Optometry, if you don't know what an optometrist is, it's a primary health care provider dealing with vision in the eyes. We are a 4-year cohort-based program, solely optometry. We are small, private, single purpose. We've been doing it since 1932. Just have one optometry program. So I'm here to talk to you and answer any questions you may have. Thank you.
Excellent. I think that's everybody. Great. Okay, cool. So that started, we're just going to be talking about general, more broader topics now. You guys covered the general idea of what your field does, what the practitioners do. So if anybody has questions about that, feel free to ask. But I think what we're also start talking about is what can students expect when they are applying? What does the application cycle generally look like? Is there a centralized application? Maybe discuss a little bit more about how students can prepare for this.
Do you want to keep that order of dentistry, pharmacy, optometry so we know who to go next?
If that helps, sure. But if anybody wants to jump in, feel free to do it anyway.
I'm happy either way.
Okay. Well, Melissa, do you want to go first? Oh, sorry. Did I cut Jamie off?
Joy, unless you want to go, I'll hit the Farmcast highlights. So there is a centralized application system for pharmacy school. Every college or school of pharmacy does not participate in it, but the majority of them do, and it's called Farmcast. Their admissions cycle runs from the middle of July every summer. It opens a new application cycle. Different schools have different deadlines. They run basically for about 11 months until they close it off for a month and then start the new cycle. So typically, for example, our program will set our program's admissions deadline as February 1st for applicant information to be submitted. We have the ability within Farmcast, as all the other schools do, to change their date, extend the date, never earlier, but we can go later if we choose to do that. And we can even grant extensions to individual students after the deadline, if that's something we choose to do. The application usually opens around the second week in July. It is, I feel like, pretty, I won't say lengthy, but inclusive. It's not so much, I think that the part that takes students the longest and that they don't realize is going to be as labor intensive as it is you have to enter all of your coursework on a semester by semester basis for every school you've attended in chronological order. And you have to assign each course to which semester you took it. And so that part is a little bit labor intensive. So it's just something to think about when you plan out your schedule about when you want to apply and kind of what you're thinking about for that. It just takes a little while to get all that stuff entered. So once you put all of your information in, your demographics, your courses, you do your personal statement or essay, whatever you'd like to call it. And you'll put in information on some folks that you want to write letters of recommendation for you. You'll request your transcripts from every school you've gone to. If it was dual enrollment, it doesn't matter. You still have to do that. Every individual place, or Farmcast will send it back to you and make you do that. Once you hit submit on everything, your letters of recommendation and transcripts can come in when they get sent. You should send everything in and submit it as early as you have your portion, that's what I call it, your personal parts of it ready. There's no reason to hold on to it waiting for other pieces to come together. You'll get an applicant number and Farmcast will track your application and all the different pieces that way. So don't waste time waiting, thinking, oh, well, I can't hit submit until all the letters of recommendation have gone in or until they send my transcripts. Just do what you can control and send it in. So I think that's the best. Joy, please tell me, because I'm sure I forgot stuff.
Oh no, you're doing a great job. You're doing a great job. Because we both work at the same application system, and so you're doing a great job. And well said, especially about submitting the application once you've put all of your personal components in it, because it takes Farmcast a good 2 to 3 weeks to process the rest of that. And of course, you want to be in that pool of students to, as soon as you get complete, you want want to be submitted for review as soon as possible, because of course of all of our programs, they're competitive. And so you're wanting to do everything you possibly can do to stay kind of ahead of everything else and the processes. And so very well said. And keep in mind that it does take a couple of weeks for Farmcast to finish their part. So hitting submit is only going to help you finish a little better.
Yeah, and I would say Joy can probably agree with me. The earlier you submit it,
Yes.
the
Yes.
quicker Farmcast can process it. Once you get into January and February and March, those are the really heavy deadline months. Most schools are going to have their application deadline be somewhere in that period. Not always,
Right.
but those are probably the most common ones. So once the deadlines are approaching and everybody who hasn't gotten their stuff together yet, getting their stuff together,
Yeah.
Farmcast is trying to process a lot more applications at one single time. And so that's when they are the slowest.
Yes, absolutely. And most of us have rolling admissions. And so if you are ahead of the game and you are finishing, say, September, October, November, you're applying for spots that whether it's 75 spots, whether it's 55 spots, wherever you're going, you're applying in a program where the rolling admissions is allowing you to be able to process your applications earlier, and hopefully that you get a spot and you're not applying for 10 spots that are left in January or February or March. So that's why it's very important to schedule out when you need to apply. And also keep in mind that in pharmacy school, I'm not sure what the other schools, in pharmacy school, you're basically applying a year before you want to be into pharmacy school. So that's very important to think about too. I always suggest with my health science class students, I teach pre-med, pre-nursing, pre-pharmacy in this particular course. Try your best to have it done during your fall break at the latest, because during your fall break, that's when you have time to work on your personal essay. I've been at webinars through Farmcast that said the number one reason why students do not hit submit is their personal essay. It's because they don't really know what to write about in the 20 plus years that you've been on this earth, and you're like, where do I start and what do they want to know? And a lot of students will put that off until after classes, or and that just puts your application in a spot that makes the spots even more competitive for you being in or applying to the program. Anything I've left out, Melissa?
Nope. I think we've got it. We've got it.
We got it. Okay.
We've got it. Yeah, absolutely. I think you got anything I might have missed, and vice versa.
Perfect.
Great. Mike, do you want to go next?
Yes, I can definitely go next. Similar to the other programs, we also do rolling admissions. Our applicant cycle each year opens on June 1st, and it goes all the way to March 1st. It is highly, highly competitive. Each year we receive between about 800 to 900 applications, and we award 135 seats per class. So that's very, very competitive. And like the other programs, the best thing an applicant can do is early application. No matter what your profile of a student is, it's best to submit what you can when you can, so we can get working on your application. That also helps us to get to know you better. We receive so many applications that, after a while, you don't want to be just names and numbers on pieces of paper. We want to put a face to the name. So the earlier you can get us your application materials, the earlier we can get moving on that. So doing rolling admissions, that means we evaluate, we interview, and we give out acceptance offers as qualified applications come in. We start interviewing very, very early. I mentioned that the application cycle opens on July 1st. First week in August, we're calling in our first applicants to interview. And similar to the other program before that, you're essentially applying a year before you intend to start. So the students that apply early and get to those early interview slots, they have essentially interviewed and sometimes been accepted into the program of their choice before they even start their senior year of college. So that's just another reason why an early bird gets the worm, and being on the ball can benefit you that way. All the application materials is kind of similar, across the board. We require letters of recommendation. You have to enter in, all your transcript information, like was mentioned before, pretty tedious. And again, doing it earlier can give you more time to do that. And you definitely want to at least get your application materials in before the end of fall, because January, February, that really ramps up. Things get more competitive. Sometimes we're even starting our waiting list in January. If the student does end up on our waiting list, that does not mean you're not going to gain admission to the program. It just could delay it even further. And I just think for a student's own stress levels and everything they have going on, that's an easily avoidable situation to not end up on the waiting list. Once all your application materials are submitted and we reviewed them and we view them as competitive and complete, then you're invited for an on-campus interview. And again, that starts in August and we roll all the way into the following April for interviews. Our interviews are very informal and conversational. We ask you to come on campus to complete the interview. Obviously, due to COVID, we've had to be a little more flexible with that this application cycle and do some more virtual interviews, but we do encourage you to come to campus. Our interviews are a blind process. You meet one-on-one with a faculty member. All they know about you is your name and your home state. They have never seen your file. They've never seen your grades, your essays, your test scores, anything like that. The reason we do that is we want this to be kind of a more laid back conversational style. We want to get to know you. You are speaking with someone that you hope to be a future colleague. So we figure if that person doesn't have your dirty laundry open at the other end of the table, you'd be a little more relaxed and be able to do that. That typically lasts around an hour with the faculty member. The interview is in 2 parts. After that, you will meet with someone on the admissions committee. That will be an open file session. That's not to scare you. That's just to make sure that all your ducks are in a row, all your prerequisites look good, all your letters of recommendation have come in. After that, you will receive a tour of the campus with one of our student ambassadors to give you a chance to ask questions and get a student perspective of the college. And after that, we really encourage students to spend the weekend in Memphis, get to know the city that they're potentially going to live in for 4 years. Our turnaround time from application to interview to acceptance is very quickly. Hypothetical situation, typically we do have our interviews on a Friday. The admissions committee typically meets the following Monday or Tuesday. You get a phone call that next Wednesday, potentially offering you a seat in the class. So it's usually less than a week of turnaround time from interview to acceptance. And again, the earlier you apply in the cycle, the more seats we have available, the more often the admissions committee meets, the earlier you can be accepted. So I always tell students whenever they hear one of my presentations, if you take away 2 words from anything I have to say, it is apply early. All right, thanks.
That seems to be a theme, so that's very helpful.
Yes.
Cool. Does dentistry want to go next?
Jamie, you want to jump in there first?
Sure. So they've covered everything about the application that you could possibly cover and more. So I'm not going to have to add anything except for our dates. So our application opens June 1st. It's got a soft open May 11 to let you get started on the application. That way you can submit it on June 1st. And it closes September 30th. And then our decision day is normally the 1st December, the first work day in December. That's what it is. Sorry about that. So this past year, they moved it to the 15th. They kind of moved all of our deadlines up a little bit. So, but I believe it's going to be whatever the first business day in December is. So, but you need letters of recommendation, pretty much just like all the other programs I've already told you. I think we all do around the same thing, just a different cast. So we use ADSAS. Dr. Covington, do you have anything to add?
No, as far as the particulars of the application, the CAS, Melissa and Joy really did a good job. And I certainly agree with Mike's two words, apply early. The longer the application's in our hands, the better chance you have of getting an interview. Like many of you, we start our interviews very, very quickly as soon as we get our verified applications. All the professions are competitive, quite competitive, and but they're all certainly worthwhile. Jamie?
All of that's the same, except U of L's dental school, our deadline is a little different. We accept applications all the way up until the end of December. Yeah, but everything else is the same.
Well, thank you, everyone. Next question, I guess, would be what would make a good or great candidate? What are you really looking for within your programs? And maybe we'll start with dentistry this time since we ended with them.
One thing I can think of is you need to like people. You're going to have somebody about 14 inches away from you for the rest of your life. And so if you don't like people, dentistry is the worst profession I could think you could look into. You need to be able to communicate. Need to be able to make good grades and scores, because we're trying to make an academic decision on you. But the main thing is, I don't know why I think this always, I've been practicing almost 40 years, but you need to like people. You really need to like people. Jamie?
So that's the $1 million question, isn't it? What do we look for in an applicant? It's probably the hardest question to answer. It is, we have some core competencies that we look for in applicants, and the easiest way to tell student, and then because they always want to know, what can I do on my application? And the answer is, I can't answer that for you as an applicant, because I don't know enough about you and your life and your interests and your passions. But I can tell you what the competencies that we want: active learning. I mean, you have to be academically proficient. You have to be academically sound. You have to have empathy and compassion. You have to have some technical knowledge and skills, communication. So that's what we want. But how a student demonstrates those on an application can vary greatly depending on who the student is. And so we go with end game. These are the skills, but what you do on your application to demonstrate that you have those competencies could vary greatly depending on the student and their path and their journey to dentistry.
Excellent. Mike, I see you unmuted yourself. You want to go for optometry?
Absolutely. Similar to before, we are looking for people skills, communication. This is another profession where you are a few inches from people for the next 35 years of your life. So you definitely have to like that. We are looking for service-minded people too. Physicians should be passionate about service. They should be passionate about helping people. If that's not a passion of yours, you're probably not going to enjoy that next 35 years of your life in practice. We're also looking for high academic achievement. Grades aren't everything, but in the health professions, they are very, very important. The curriculum is very, very rigorous. You need to demonstrate to us both through your coursework and your pre-admissions test, which is the optometry admissions test, that you are up to the challenge, that you're able to perform that. You also, during your 3rd and 4th year of optometry school, you have to pass your national board exams, which are very, very challenging, rigorous tests. So you have to be able to demonstrate that academic aptitude. We are looking for experienced people too. Doesn't necessarily mean you have to work in the field of optometry before, but we want broad exposure to the profession. Optometry is a very, very diverse profession. New needs are arising every year. There's many different modes or ways you can practice optometry. So we really, really encourage job shadowing. We want you to visit as many different doctors and as many different types of offices as you can to really see how they live and how they operate their practices. So that is really, that's one of the big things that we're looking for in a strong candidate at Southern College of Optometry.
Thank you. I guess next will be pharmacy.
And I can go next. Just to say that all of your professions that you're looking in, especially in this breakout room, you're providing a service for people. And finding where your passion lies is going to be extremely important. So for pharmacy, of course, pharmacists are the practitioners of treatment. So if you decide that treatment is what you are passionate about, you need to show that. So for instance, you can say, I'm a people person, I like people, but if you are lacking in service, or if you're lacking in your people professionalism, then that's going to show in your application. So what we're wanting you to do is to have quality versus quantity when it comes to service. And I mean, you could have 2 service listings on your application, but you could, I mean, if you're passionate about that service, it's going to come through. We look, most of us, I think all of us actually look at your application holistically. We call those soft skills high attitude, high character, high effort. And those are going to come through not just putting words on a piece of paper that ends up being 14 to 22 pages long, but it's going to show through with your quality versus the quantity. And that's all I really wanted to add.
I don't know what else to chime in at this point because I think they've about covered everything. I would really agree with Joy that students a lot of times will say, "What can I do? What club should I join? What what can I do to make my application great?" Well, you can do a lot of things, but that doesn't always look the same for everybody. Grades are important. If I get you into the program and I have you as a student, I want you to graduate. We're not trying to wash people out. This is not like you see in movies where we're going to, they sit you in an auditorium on the first day of class and say, look to your left and look to your right. And after the first semester, half of you won't be here or whatever. That's not the goal. So grades are clearly going to be important. You have got to be able to finish the curriculum. But for some people, there's other gifts and talents and experiences that are going to add to that. So there's some combination out there and there's no perfect formula. We don't have a formula that I can say, oh, well, if your GPA is in this range, then I can give you 5 points for this. And then if you were in this club or you had an officer position, that's this many points. It doesn't really work that way. It's great to join a lot of things and be super involved. If that is your passion, if being in a lot of things and doing a lot of different things is what gets you excited, then do that. But don't join a bunch of things and do a bunch of things so you can put it on my application, because that's not going to tip the boat. What I want to know when you come through the door and you have an interview or you even have a meeting, with me or a phone call or anything before that point, and you want to talk, I don't want to see that you've done 10 clubs. I want to see that you've done 1 or 2 things that you feel strongly about. And that can be something at your university, that can be something in your community, that could be something at your house of worship or whatever your thing is. There's not like a really set formula for that. So I want to know that there is something that you care deeply about and you have spent your time and energy on that, and you can convey to the admissions committee or to me or whomever, this is what I care about. And I hopefully for pharmacy, although you typically don't have to be 14 inches from somebody's face in pharmacy, as you might in dentistry, there's really no way to be a pharmacist and not be around people. There are a few ways, but not a lot. I mean, you have got to be comfortable with that. So you have got to really want to help people and be involved in their lives a little more deeply than maybe you might have thought about. So however that looks for you, that's the way that you make your application great. But what works for, Ahmed is not going to necessarily work for Miller, you know what I mean? It's all going to be a little different. So find your niche and find your thing. And that's great. That's what it needs to be.
Also, I want to add to that. You've got different components of the application that's asking different questions. And I get this a lot. I've been at Gatton for over 13 years, and I've seen pretty much every type of student that's come through. And sometimes some students can get confused thinking that they can overcompensate with one thing versus the other. So for instance, if your grades are suffering because you're so involved and you're so passionate about the social aspect and being out there, and that's great, but you need to find a balance because they're asking two different questions. And one of the questions with your academics and your transcripts, what the application is asking in the program is, can you do the work and have you conditioned yourself enough to be ready for the program hitting the ground running? You can't compensate social services to answer that question, and vice versa. You can be academically 4.0 and not been involved very often. And so we want to know, do you know what you're getting into? So they're two totally different questions. So hopefully that's helpful to separate the two of those. It's not something that you can compensate doing one over the other.
Thanks, everyone. It sounds like it's a very holistic approach to application where there's not one that's great. And there's a lot of things, components to go into it. So that's helpful. Another question similar to the application is experience. So I know the time that we're in now, gaining shadow experience and all of that right now is very difficult. So what advice do you have for students who may have had like a opportunity over the summer that was canceled, or they're not able to find something this summer and they're getting closer to the application deadline? Mike, you want to start for optometry first?
Absolutely. And I actually just reached out to our admissions director today to discuss this, to kind of anticipate this question. The answer is it's not a one size fits all situation. Just to kind of give you the 30,000 foot view, we do have pretty stringent job shadowing requirements. We like you at minimum to shadow at least 30 hours in at least two different practices, two different modalities, be that maybe private practice optometry, hospital clinical setting, retail, corporate, academia, something like that. But with this current situation, we are well aware and sensitive to the fact that a lot of students are not able to get the experience that they need, and there's nothing we can do about that. That's just the situation we find ourselves in. But it's different depending on where you are. You know, if you're located in California or New York, you know, the restrictions in those kind of areas might be a little more stringent than other areas of the country. So again, it's really not a one size fits all situation. Some of our applicants in the past year have been able to complete their shadowing requirements, no problem. Others have been limited. Some have not been able to do it at all. If you're in this situation, I think the best thing you can do is speak up. Let us know what's going on. Let us know the situation so we can work with you. One thing that we've been able to do for a student that really is in a situation where they can't get out and gain that in-person experience is to call optometrists, set up meetings, set up phone conversations, email, interview them, ask them questions, what their life is like, what their practice is like, and then report that information back to us. Number one, that shows initiative. That shows us that you're trying to reach out and trying to solve this problem. Our admissions director very bluntly said that he just had to reject an application that came in with zero shadowing experience and zero explanation as to why that happened. So again, that it's just kind of, it's a little on you in this situation to at least just kind of, like I said, speak up, let us know what's going on, work with us, work with the admissions office so we can kind of get to know you, your unique situation, and develop an action plan that's right for you. So that's how we're handling it this past year.
Thank you. That's helpful. Either pharmacy or dentistry, whatever wants to go first.
All right, I'll jump. At UT, we don't specifically require shadowing or work experience. We strongly encourage it, but there's not a box to check for me to say, oh, you have it, so you've met that. And what I want you to get out of it, or what the committee wants you to get out of it, is not necessarily, again, just to check a box and say you have the experience. It's what you get out of it, and it's what you know and what you've learned about the career and what sort of seeing yourself doing it and why you think you'd be good at it, why you think you'd like it. So even under normal circumstances, I would not disqualify you from admission, or nor would anybody else, because you don't have work experience. The admissions committee would probably discuss that and say, okay, well, what did this applicant know about pharmacy? Were they able to tell you that they know something about the career? Were they able to tell you why they feel like they are a good match for the career? What are their traits that, are helpful? What are the things they're good at? Some people do get that through work experience or shadowing experience, and that's perfect. If you're somebody that can't do that, or for whatever reason, my next suggestion has always been, see if you can talk to your pharmacist that takes care of you or your family when you need medications or you need something, or go to a pharmacy near you and say, hey, I'm Melissa Smith and I'm interested in a career in pharmacy and I'm not able to shadow, but, is there a pharmacist here who might let me email them, or, sit down for 15 minutes or 30 minutes or whatever they can do sometime and talk to me about what was their path, what they major in, why did they want to be a pharmacist, how is it exactly like they thought it would be, how is it not at all like they thought it would be, if they were going to start over, would they do anything differently? That's all super important information, but you can get that other ways besides working or shadowing. I think the sort of last, and I hate to say last ditch, I just don't have a better term for it. I think your last kind of way to get to that, if you're not able to do any of those things, and certainly now during COVID, it's very difficult to do anything. Dr. Google is sometimes very dangerous, but also Dr. Google is super helpful. Sometimes, go out and look up pharmacy, look up careers, look what type. I promise you're going to find 25 kinds of pharmacists you never knew existed. Even if you've had work experience, go look and see what those careers are and say, hey, I would like to be a nuclear pharmacist because of this, this really sounds good to me, or I'd like to be a cardiology pharmacist because this sounds good to me. They're all different and they all appeal to different people. So being able to convey to the admissions committee or to the college, hey, this is what I've done. This is what I know about this career. This is what I can see myself doing, or why I see myself doing this. This is what I'm passionate about. This is why I would make a good pharmacist. That is going to be enough to carry your application with or without, because I have interviewed or had applicants interview that have 10 years of work experience, but still can't really answer that question. So there's kind of a balance there between, do I need to work? Do I need to shadow? How can I know what I'm getting into? And it's not much like a lot of other things. It's not the same for everybody, but at the end of the day, you need to be able to communicate those things to the admissions committee, however you can find to get there.
I agree with Melissa. Something that a resource that all the pharmacy schools have access to through our accreditation is AACP, and that's pharmacyforme.org. And and a lot of our pharmacy schools collaborate together and they put forth bios, and different faculty members are on there. I know both UT and Gatton College of Pharmacy are on there. There's videos. It's such a great resource. And there's a quiz you can take that matches up your personality to what would be a good fit of this list of pharmacists. So you may match up to cardiology pharmacy, or you may match up to pediatric pharmacy, and then you can do your research, do your scholarly research. But anytime that you can be in front of patients and patient care is going to be acceptable, because you're going to be treating, whether, for instance, maybe you're volunteering to be a patient transport. I know that the hospitals are still allowing students to volunteer. So just anytime that you can find an opportunity, and just think of it this way, you're putting yourself in a very competitive atmosphere as an applicant, and you would want to show effort and not excuses, no matter where you're going to go. So as a committee member looking at your application, they're going, as someone who's providing a service, your patient isn't going to want excuses. So does that make sense? I know it's really late. I've been on 6 hours of Zoom.
I feel you. I think sometimes even the experiences you get in other professions that maybe aren't pharmacy or aren't dental school, I shouldn't speak for other professions, but sometimes the experiences you may have been able to have in the past or may be able to have now with something else can help steer you, even if what it is to know this is not what I like.
Right. Yep. And this is why I've decided I love the treatment side. I was pre-med. I get this a lot too. I was pre-med, or I was pre-this, or I was nursing, and I realized something happened or in my own life or in my family's life, and I loved the treatment. So I'm sure that's the same thing with the dental side. I mean, that is one very centered type of service you're going to have, or optometry. Something has happened in your life, or that's made you be able to go down that path.
So yeah, I just say don't discount those experiences, or think that
Right.
if you're applying to pharmacy or any specific profession, that those experiences, even if they were in a different medical profession, they're still providing learning and insight for you about what you're choosing to do. So don't think, oh, well, they don't want to know about that because it was a different profession.
And it goes back to what Mike was saying. The more you communicate about your experiences and your efforts, it's going to show in your application and in your process.
That's all really helpful advice. Does anything else to add? Dentistry, is there anything else that's specific to shadow experience you're looking for?
Well, I think Joy said it once. You've got to know what you're getting into. Dentistry, if you're only experienced in dental office, has been getting your teeth cleaned or going to the orthodontist, that is as far apart from general dentistry as I can think. And so we insist you shadow in a general dentist's office if you're able to. You can also shadow in specialties. But you must know what the day in the life of a general dentist is like. Jamie?
Yeah, we're similar. We are specific and state that it has to be general dentistry because, again, ortho is not general dentistry and it's very far from it. And COVID related, similar to the other schools, we just want you to do something. We are understanding. Sometimes people think admissions people aren't understanding. But we know that the way the world is right now, that it's hard to get into a dental office. So the job interview is good. Interview a dentist. Some places are offering virtual shadowing. We will accept that. There's YouTube channels, pretty much anything. Just do something in order to expose yourself to the career in the field that you're getting into.
Wonderful. Thank you all. So we have about 10 more minutes left. If anyone has questions they want to ask, by all means, this is the time to ask. So feel free to unmute yourself or type it in the chat.
Hi, yes, I have one question. So I was thinking about getting dental assistant certified over the summer. Do you think that is a thing that I should do, or would it make me stand out, or something that, not necessarily stand out, but would you recommend doing that if I had the opportunity to?
You said dental assistant, right? Is that what you said?
Yes.
Oh, I mean, from our perspective, I would any exposure. So if I don't know that you need the certification. I think sometimes those can be. I don't know that I would recommend you going and paying a lot of money just to get certified. In our process, the certification itself is not necessarily going to put you above and beyond other applicants, but any exposure. But I don't think you need the certification. That's not something in our process that we say, oh, well, they are a certified dental assistant that gets this many points or puts them above other people. But it is great exposure and great experience and adds to that technical knowledge component of our competencies that we look for. But not something I would recommend you going and spending a lot of money on if that's what you're looking at.
Any other questions?
I also had a question. This is mostly directed towards Melissa and Joy because I'm interested in pharmacy school. But Thinking about the application process, if I'm taking a prerequisite the fall of my senior year, so technically it would be in by that February 1st deadline, would it be still worthwhile to go ahead and submit my application by that fall break deadline?
Yes, please.
And so obviously, I not get an interview potentially until y'all receive my transcript with my that final prerequisite, or how would that work?
Joy, you want to go first? I'm sure that's going to vary a little bit by school, although we could be the same. I'm not sure.
Sure, sure, absolutely. No, absolutely submit your application. And when you're in Farmcast, you get the opportunity to put pending. And then you can also put when you're going to anticipate taking that course. By the time you are a junior or senior, you have enough sciences and math classes under your belt for us to be able to make a sound decision on your conditioning, on how many classes you've taken each semester, and how successful you've been in those, and did you have an upward trend, all those kinds of things. So don't worry about that prerequisite having to have it finished before you hit submit. And then how that happens, or how that works, is say you receive an acceptance, say in that October timeframe, your acceptance will say in the letter it's contingent upon you successfully completing those prerequisites before or at the end of that spring semester.
Pretty much the same for UT. So
Yeah.
Almost everybody who is filling out an application has still got coursework in progress. And you may
Yes.
even be taking that coursework in the spring after you apply in the fall.
Yes.
Literally every single letter of admission that comes from our office, every single one says it's contingent upon successful completion of all of the requirements and prerequisites, because there are other things too that you have to do before you can step foot on campus, and those have to be completed.
Right.
So even if you had every single course done before you ever hit submit, you've got to have a background check, you've got to have a drug screen, you've got to have all your immunizations. I mean, there's a whole list of things you have to do, and you cannot start the program if you've not done those. So never wait to take every course before you apply, because it's not like that's bad. It's just that you're wasting your time. We typically ask you to have all of your coursework finished by the end of the spring semester before you enroll in August.
Yes.
There can be case-by-case exceptions if there's like a first term summer course or something like that, but our stated requirement is by the end of spring. So almost everybody who ever applies has still got something that is either in progress, or things that are in progress and things they're planning to take the next semester. And you're going to have to send us final transcripts at the end anyway. So no worries.
Yep, absolutely.
Thank you both so much.
Welcome.
Hi, this question is for Ms. Myers and Dr. Covington. I am a senior and I'm currently an active applicant for the application cycle, and it's still under review, which is, I don't know if I'm still pushing my luck too much, but do you have any advice if I'm going to reapply for sure if that happens? Is there anything, I am planning on retaking the DAT. Is there anything else you could tell me about reapplying, or is there any options that the application gives you for reapplying?
Well, if you have not gotten a letter from us saying that you've been denied, you're still in the running.
Right. Okay.
That didn't answer your question, did it?
It's relieving to hear that, but
Mhm.
I don't know when the class is going to be filled, or could you tell me when is the wait list going to be pushed? Or I have not heard anything. That's what I'm just worried.
If you can tell me, then you won't need to go to dental school, because we have no idea. It's just one of those things that day to day, it's something different. I'm sure Jamie is the same way. It's just, I could be full tomorrow and then a week later have 3 spots. So it really, yeah, it's amazing. Last year, I think we had 3 openings in May, which I thought was very strange, but you never know.
Okay, gotcha. No problems. Thank you. Thank you for that.
You're welcome.
Any other final questions, or any on the panelists want to mention one last thing in the final 2 minutes we have?
Yes, a quick question about the dates of the application submission for the dentistry school. When does it start again? I didn't catch it while you guys were saying it. Sorry.
For UT, the application is a soft opening on May 11, so you can start your application. And then the first day to submit is June 1. I think it's 1 or 2. It's usually June 1. And our deadline is September 30th. And Louisville has a different deadline, so I'll let you talk.
Yeah, our deadline is December 31st. I think is what our deadline is.
And the admission, like the answer or the admission, when like the time frame of the admission starts?
All offers for dental schools, we have that national signing date, so they go out. It's a predetermined date, should be December 1st. COVID, it was delayed 2 weeks, but dental schools aren't allowed to admit anyone prior to December 1st. So for us, if you're applying after December 1st, then you've already missed that initial offer period, but we do still continue to do usually 2 interview days after that. But yeah.
Thank you. Appreciate it.
Mm-hmm.
Great. Well, thank you all. I appreciate all the panelists coming out to talk to us about your program, spending the night with us. This is very helpful, informative, so I appreciate everything. Hope everybody has a great rest of your night.
Thank you.
Thanks for hosting.
Thank you. Thanks, everybody.
Thank you.
Bye.
Have a good night.
Night.